Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Complicated marketing people.
All right, here we go. Episode 2 again in 3, 2, 1.
Welcome back to Between Two White Coats, where we are thrilled to have our friend Kristen with us for another episode. If you have not listened to Kristen's first episode, I would recommend that you do so. It was really insightful about her weight loss journey, and I think a lot of people are going to relate to a lot of things that you had to say. Thank you for sharing all of that. And Amber, what stands out to you as to what Kristen said already?
So in the previous episode, which we need to tag Every Day is Darling, make sure that people know that that's her thing. So if
Every
you
Day
didn't
is
watch
Darling
it,
on
go
Instagram.
look at her.
Yes.
And she said she's gonna post them like before and after too, so that'll be fun.
Yes.
I did get that from the last episode.
Yes, you did get that.
But one thing that really stood out was when you said the Memorial Day weekend you were done. And so I often see that as a medical provider. Yeah. People come in and will just be done. They're usually overwhelmed or anxious, tearful, and just like usually there's a time when you are overweight or most people know they're overweight. It's not something that someone needs to tell them. But then they have this moment where they're like, okay, I'm done. I'm ready to do something. So that was one thing that I kind of took away, that you had that moment, which a lot of patients have that moment.
Yes, and that rock bottom moment happens with a lot of things, but we also would encourage people as healthcare providers that you don't have to wait for your rock bottom moment. You don't have to wait till you are so done. When you are so done, get help. Yeah. But when you are on your way to done is also a good time to say, hey, let's start a conversation. And then what stood out to me is how hard that conversation was for you to start.
Yeah.
Because you had a good relationship, have a good relationship with Scotty, our medical provider here who takes care of you, but yet still it's a hard thing to talk about. We feel when we have failed in weight like we are bad people.
Right.
And there's not many times, there are other things where we tell someone that you have, what I would compare it to is when we tell someone that they have something related to smoking. And there's a great sense of guilt because they've done it to themselves.
Yes.
And I think that we do that with weight too, but that's just not how it goes. And let's not assign blame. Let's just get better. And so that stood out to me too. And then we left off on the last episode and talking about goal weights and talking about what do we do when we're getting to a goal weight? How do you decide what your goal weight is? And I think it's true of every person I've done weight loss with. If I ask them what their thoughts are when they're starting, it ends up not being the same as when they're getting closer to the finish line. Yes. To me, that's like asking, okay, if you're going to run a marathon, how are you going to run that last mile? You don't know. You just keep running. And I think sometimes when we try to talk about goal weight, it's too big. It might feel too far away. If we said to you, well, your goal weight will be 60 pounds, 70 pounds, you would be like, oh my gosh, I can't do that.
No.
And so sometimes it's even, so let's talk about goal weight. When you first starting, what were the idea of goal weight, and did that intimidate you? Was that something that you had pretty much pictured? I want to be like I was at this certain age, or?
Yeah, so I wanted to be, my goal weight was around 150, 155, 160, somewhere in that 10-pound range.
And remind us, where were you starting at what weight were you starting around that time?
I believe I got on the scale that first appointment with Scotty, and I was 195, 197. I called it 200. I said I'm 200 pounds. So I wanted to get back to like 150. I wanted to lose, a decent amount of weight. And 150 was pretty much what I had been through high school and leading up to my first pregnancy. And that's just the weight that I knew. Well, losing the weight, that goal kind of changed. And I saw that I could lose weight, and the medication was helping me drastically. And just kind of seeing you hit all of these weight milestones, like the 10 pounds and the 20 pounds and the 30 pounds.
Were there other milestones? People don't realize this sometimes. Like, I'll hear people say, well, I could cross my legs again. Like, were there any things like that you're like, God, that would be a goal weight? Like, I'd want to do one push-up, or I'd want to go play with my girls. Or was there another, like, besides just a number on a scale,
right,
was there something else that was motivating you?
It was the clothes fitting. And I will say too, I did not obsess over getting on the scale. I would weigh in here, of course. But in between appointments at home, I never would like obsessively stand on the scale, because I was seeing differences in my clothing. And,
which for an influencer is huge, right? Because you're wearing clothes all the time.
Huge, yeah. And I felt better, and I noticed that I could I just felt better. I felt better, so I knew the scale was going to be reflecting that as well.
I think when we say, what is your goal in first visits, I'm always thinking, and I still, after doing this for so many years, I still screw it up. I'd say, what is your goal? And someone gives me a number. Mm-hmm. And what I'm always asking is the kind of stuff you were saying. What is your motivation? What are your, you want to be able to have more energy. You don't want to take a nap in the middle of the afternoon. You don't want your knees to hurt as bad. Like, those are the kind of things I'm always thinking of. What are our goals? Or your goals are to hydrate better, to eat better, to move more. Mm-hmm. And people always jump to the pounds. Mm-hmm. And I do think that a necessary conversation around goal weight is to not obsess over the pounds. And so you even saying, like, I allowed myself to not just be on that scale nonstop, but to use other ways of measuring success. Mm-hmm. But Amber, when someone asks you, you're starting a weight loss journey with someone and they say, what should my goal weight be? How do you answer that?
I normally will say I won't talk about it the first visit. I normally will say, because weight loss is it is medications, and that's what we're here to talk about, is like, how did you use the medications to your benefit? Because they need to be used. We have the tools available, and I always say, what other tools do we have? And medicine is often but one of those tools. Mm-hmm. And trust me, I will say all the time, I would take any of and all of them. If I needed to drop weight, exactly right. I would not think a thing about it, but I'm also comfortable in the arena of medication. So like, when people are coming to me and saying, what do I need to do? Like, a common thing I'll have is patients are like, kids are getting married and they want to lose weight so the mother of the bride doesn't look, they're like, I just want to be skinny in the pictures. They have something in mind. So often I will not talk about a goal weight initially. I will say, okay, let me get your lifestyle stuff under control first. Yeah. Because and we could do this, I don't know if you've done a body comp, but like, BMI is so convoluted, and yes, we use it. It is a vital sign, and I am looking at that. But it also is, how are you made up? Like I mentioned in one of the episodes, or the last episode, like, you've lost the weight, but you don't to me look sick at all. You look fabulous. Like, I would be like, girl, you need to gain some weight if I felt like you did, but you do not. So like, the weight that you are currently at with your height, your BMI is normal. I know it is. I can somewhat calculate it in my brain, but like, you don't look sick from that. So some people would, if they lost 60 pounds, and they wouldn't need to do that. And you don't know until
you're getting there.
And
you just cannot.
Yeah. So I always will say, they might even mention, I want to be 150 pounds. And I'll say, let's wait on that. Let's see what let's get the first 10 down, and let's get the other stuff, like our sleep and our diet and exercise and hydration. Yeah. And sometimes I won't even throw all of that at them. I'm like, can you just drink some dadgum water? Like, could we just start there? Like, let's not get into numbers.
So there's so many things you're saying stand out to me. One, you want to de-emphasize the goal weight. So do I. I just don't, I think that's one of the things that everybody's doing wrong is, I am this and I need to be this, and it's a number. Mm-hmm. And then what stands out to me also is when you're saying, well, you don't look sick, you don't look underweight, you haven't lost too much weight. It's not about the pounds. What are you losing? Yeah. And if you've lost weight, but you've gained muscle, which is exactly what we're trying to get you to do, then you're going to not look all sunken in your face and look underweight. But when you gain muscle, that's going to be a different number of pounds. So, for some people, it might be that once they lose 30 pounds, but they're losing a lot of muscle, we're like, whoa. And then other people, they, build back 10 pounds of muscle.
And they look,
and
I have a
and
picture.
They look great, and it changes the pounds.
I need to throw up my picture, because I weigh more than I do in this one particular picture, but the mass has changed, right? So it's like more muscle now. And it's hilarious. Me and my best friends I might even have it on my phone right now. I might pull it up. We call ourselves chipmunk cheeks because we were skinny, but we were skinny fat.
You're skinny fat.
Yes.
And I'm like, oh my God, that looks horrible.
So, in talking about goal weight, we overemphasize it. I would say it's not even something that someone needs to worry about. And it's what you're made up of. It matters a lot. So not just a weight, but a body composition. Or now there are all kinds of scales. You can quickly buy them online, and they give you your percent body fat. So at least as you're losing, I don't want people to look at the pounds lost. I want them to look at the fat lost.
Right.
If you've lost 10 pounds, but your percent body fat stayed the same, losing the wrong stuff, friend, you're losing the wrong stuff. Don't do that to yourself. And so those things make me say, I don't love goal weight. And then also goal weight feels like a finish line. Like I hit my goal weight and I crossed the finish line and I'm done running that race and I don't have to run anymore. And so that is not how this works. Life is a constant journey of wellness.
Yes.
So when you got to that goal weight, then what?
Then I decided that maybe I could come off of the medications and go into like a maintenance mode. Definitely did not want to gain back what I had lost, but wanted to feel maybe a little more in control, and continue the habits that I had learned from being on the medication. As far as not overeating and focusing on protein and focusing on moving my body. And I'm not like a gym rat. I am not one that you're going to find in the gym lifting weights.
You don't get that whole exercise high?
Yeah,
gotta have it every day?
No. But
no.
I think people also can feel like you have to be that. You have to be, in the gym every day doing this and that and doing this many of this and this many of that. Go on a walk.
Right.
Like I did a lot of walking with my girls just through the neighborhood, like on scooters, and it wasn't targeting any specific area, but I was moving my body and I was doing more than I was.
And you're spending time with your girls, and what a great example for
Yeah.
your girls.
Yeah.
And doing something you liked, because throughout this journey, if you're just punishing yourself, like you said, you had lost weight before trying a medical approach, but you were starving yourself and it wasn't sustainable.
Yes.
And so if you're going to the gym for 2 hours and you hate everything about the gym and the dude in the corner grunting is just not your thing, then you are not going to sustain this.
No.
But going on a walk with your girls, you can be like, I forgot I was exercising. That was so much fun.
And it doesn't have to be scary. It doesn't have to be, you're connected to the gym or you're, this or that. It's very simple. It's very, very simple lifestyle changes you can make that doesn't have to be, following a program or scared to make the wrong move with this or that. It's just do better every day in little ways.
And what was that duration from the time you started to the time you were like, I think I'm at my goal weight? Was about how long?
I think it was about 6 to 8 months.
Yes. And so in 6 to 8 months, you had changed your approach to food, your approach to quantity of food.
Absolutely.
You had changed your movement.
Yes.
Your choices for getting some protein in, forcing protein in when, protein powder or whatever else, you were supplementing in certain ways.
Yep.
And so then when you were hitting your goal weight, you were thinking, let me see if I come off the medicine, how I do. And then what happened next?
So I decided to go into maintenance mode and took a shot every 2 weeks. So I still had a little bit of the medication in me, helping with the food noise, because that was my biggest thing, was constant food noise, always thinking about the next meal, the snacks in between the meals. And I did not want that to come back. So that it helped the food noise, but it was a little harder. I did have to put in more mind effort with stopping when I felt full, even though I could continue to eat. Just stop. I also learned while being on the medication full time that you don't need your entire plate.
Yeah.
You really don't.
Our American plates are really big.
Yeah. I know I will not die if I eat, 10 bites instead of 20. So that was something that I tried to stick to, was the portion control, continuing to move. And it did give me more wiggle room in enjoying things, indulging every now and then, which I couldn't always do on the semaglutide full time because it would just make me too sick. But it's nice after all of that work on the full-time medication, having those moments where you can indulge but not get completely off track.
And when you say maintenance mode, just to explain to people, there's a lot of ways that people do weight loss programs, and our weight loss program is heavily medically driven. Amber, myself, our other team of providers all weigh in. We do our research, and then we say this is what we think is going to be best for our patients, and then we take our experience and we try different things and see what is helping people. And we certainly know that weight maintenance is a lifelong journey. If you're not paying attention to your health, whatever that is, your health is going to go downhill. And so you got to keep paying attention. You got to keep putting the effort in there. And so we have a maintenance program with our semaglutide and tirzepatide. And what we do with that is we take a low dose and we do an every 14-day dose. So it's 2 shots a month. We reduce the cost on that as well because if people decide this is something that may be something that they need or desire to stay on, we want to make it affordable for the long run. But also then people may realize, like, in that second week, here's a little bit more of the discipline that I have to have. And so there is a little bit more of, okay, we've taught you how to crawl, walk, run, and now how far can you run on your own? And then once you get so far, let's give you another little support or boost. Some people will choose to do maintenance as a smaller amount every week. Some people will choose the, little dose up, and we try to, dose specific to patients' needs. And they will do that every 14 days. And so it's really very much about what people need, and attempt to keep just enough medicine on board to help prevent regaining the weight. And then there was a time when you said, okay, I think I'm going to try without the medicine. I've done pretty good on maintenance, and I was able to kind of sustain my weight. And then what did you realize, or what happened when you just said, I'm not going to use the medicine for a while?
So coming off of the medicine completely, the first thing I noticed was the food noise back, just in full force. And this is something I think not everyone struggles with. So for me, it was always feeling like I needed to eat again. Now I also take Prozac, and I feel like that might have something to do with it.
Yeah. So you noticed when you started Prozac also was part of when you had some weight gain and difficult losing. And
I should have mentioned that in the last episode, but the Prozac, and Scotty, that was the last medication Scotty tried with me, because she was like, I think this will work for you, but the weight side effects are big, and I know that's something you don't want to deal with. So it rang true. Fat and happy. And a lot of people won't gain weight on Prozac, but every single person's response to different drugs is very different.
Well, and I always will say too, like, if you have anxiety or depression, and you've been more of like someone that's been at home, or you are anxious to go out, but once you get the happy pill and you're happier, well, then you want to go do things. And most of the things we're doing as Americans are not hiking,
Right.
It's let's go to dinner, so I've told patients that too, like, definitely. But the medicines that make you happy make you want to do things that make you happy.
Right.
Yeah.
And so sometimes for us, that's food.
Right.
Absolutely.
And being a foodie
in
a foodie family,
it's
just
awesome.
there.
And so Prozac was part of your gain, part of the journey to gain.
Yes.
And now you're at this point where you're at goal weight, and you don't want to come off of Prozac because it's been very therapeutic for you.
Yes.
But yet you're like, I'm concerned because I still need to take Prozac, which causes weight gain in me, and I'm trying not to gain my weight back.
Right. So I think it kind of staying on a maintenance dose of the tirzepatide.
Where you switch. So we were semaglutide, then you...
Yes.
Did you switch?
So let me get into that a little bit. So semaglutide worked wonders for me. I mean, amazing for me during my constant every week dose, titrating up. all of that. And when I decided to come off of it or go into maintenance mode, I think my body had gotten used to it, and it wasn't giving me the same effect that it gave me when I initially started. So I switched to tirzepatide, and that started to give me the effect the semaglutide gave me on day one. So I felt much more comfortable on that. It's doing the job.
And these are the two, for people who aren't as familiar, these are the two medications that are most available. Semaglutide, available branded as Ozempic and Wegovy, and tirzepatide, available branded as Mounjaro for diabetes and Zepbound for obesity. And so a lot of people are very familiar with these two meds. And different people have different responses to them. Like, there's every single drug class has multiple things in the class because different people respond differently. And we have done an entire podcast on the difference between tirzepatide and semaglutide, sort of comparing the two on how they work and what the side effect profile is. So I would encourage you to tap into that one if you're sort of like, what are all these crazy pharmaceutical names that they're throwing out? So then you switched to tirzepatide for maintenance and felt like, this is helping. And I think one of the things, sometimes if you're wondering what a medicine is doing for you, pulling away from the medicine, you were on it for 6 months or more. And so it's kind of hard to remember, well, what was it before I went on it?
Right.
And then when you try to pull back, you might go, I'm good now. My lifestyle has done what I needed to do. I don't feel, maybe I was having food noise because of the kind of stuff I used to eat. And maybe now my new lifestyle isn't going to create that. So I had a little run-in with our pharmaceutical rep that sells us, that doesn't sell them to us, for all of you people who think that we are buying this, we are not, who comes and markets their products to us. And he is the Zepbound rep, and he said, people should stay on it the rest of their life. And I'm like, well, wouldn't that be nice for you? You sell it. Sell it to someone once and you get 80 years out of it. And I said, no, don't say that. I said, I'm going to give you a little medical feedback. Don't say that to doctors. And I was like, and don't say it to patients either, because I don't want to say to someone, you're going to be on this medicine the rest of your life. That's a pretty good way to make it even harder to start it. Like, am I just making a lifelong commitment?
Right.
And I just marry this medicine? And we don't know that you're going to be on it the rest of your life. A lot of people who I start blood pressure medicines are on them the rest of their life. But some people lose weight, stop salt, and start exercising, and they come off of blood pressure medicines.
And seasons, motherhood.
Yeah.
Like, this is a season that's hard. Like, we're finishing our chicken nuggets off the kids' plates. We're, hustling from here to there to here to there. We never have time to just...
And you have 3. Shelly has 1, I have 2. And we were like, we couldn't do... Could you imagine us with 3 children?
Miserable fail.
I know,
That would be a
like,
miserable fail.
It's so much work. It's so much work. And being a mom, you want to put your effort into your children first.
Yeah.
So it's hard. It's a hard season to be in. And
you may in some season be able to go, you know what, I can do this without any kind of medication.
Absolutely.
And in other seasons not. And then there are people who have obesity due to genetic reasons.
Yes.
And odds are they're always going to need something. Their genes are all working against them.
And I don't have the best genes in my family. We're not all petite, teeny little, like, legs. All of our family, all the women in my family have bigger legs. And even losing, 60 pounds, I still have bigger legs just because that's genetic.
It's genetic.
So a lot of it is genetics.
And so if genetics is there, then you may desire to be on the medicine or need to be on the medicine. If there's medications you're taking, if there's hormone changes, then you may need to continue the medicines. If not, if it was sort of like a season of your life where you gained weight, those things are kind of behind you, but the weight didn't come off, then you may be able to sustain without the medicine. But I do think a maintenance program is a really valuable thing for the people who recognize as they come off the medicines that they need the medicine, that in order to sustain. Yeah. And I think the only thing that makes us feel worse about ourselves than being overweight is gaining weight back.
Yes.
It's like we are just the biggest fail, and everyone who's lost weight has regained weight. I don't care who you are. And when you regain that weight, the way that it makes you feel is so horrible. And so we also encourage people, if you've tried coming off the medicines and you're starting to gain weight back, come talk to us at 5 pounds, 10 pounds of
If it
regain.
ain't broke, don't fix it.
Yeah, right.
Yeah.
Like if the medication's working for you, why stop?
Did you gain weight? Did you regain? Is that why you switched to tirzepatide?
I was starting to gain. I mean, nothing
Significant.
huge, but once you get down this low,
Yeah, no.
you're like,
5 pounds is 5 pounds.
Yeah.
Right.
um,
And people will say, "Oh, you're so worried about 5 little pounds. You're such a pretentious
they
person."
add up.
And that's right. Like, I would rather say to someone, your sugar is mildly high. Let's get it down. Your weight is mildly high. Let's get it down. And so, I just want to finish this episode by making the most important point that we will make around weight, in my very humble opinion. As my husband listening to this would be like, sure, your humble opinion. Obesity is a disease.
Yeah.
Being overweight is a disease.
Yeah.
And let's treat it as that, and let's apply the same rules, which brings us to hanging out with Kristen for one more episode that we're going to make you guys wait a couple weeks to hear. And we're going to talk about the trolls, and we're going to talk about,
which is kind of a new term for Shelly and I.
Yeah, because
We're old.
We're
the
young,
Instagram.
and we've
We
got,
call it the Instagram.
and we've got the Riz, and we've got the what are the other terms?
I don't know because my kids won't allow me to say them.
Oh, there is a loud eye roll at my house when I try, and I'll go, "Am I hip by saying that?" And my son Colin will say, "Anyone who says hip is not cool." And I'm like, all right. So the takeaways are, Amber and I are not hip or cool, and
if you need maintenance,
stay tuned for one more episode with Kristen, where you two can learn what a troll is and why we don't like them.
Yes.
Thank you so much for joining us today. We like to leave you on a good note. Here's today's Tell Me Something Good. Something good is challenges. This doesn't seem like it is something good when we're in it. But let's face it, a challenge is an opportunity. It's how we grow, it's how we learn how strong we are and what we're capable of. The next time you are faced with a challenge, face it as an opportunity. Thank you for joining us, and until next time, take care of yourself.